Have you ever walked into a doctor's office feeling exhausted, disconnected from your partner struggling with weight you can't shake, only to be told everything looks fine? That your lab results are normal? That maybe you just need to exercise more, stress less, or accept that this is just part of getting older? I understand how frustrating that feels, because what you're experiencing isn't always in your head, and it's not always something you have to live with. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health, about hormones, sexual function, or just feeling like yourself again, stay with us. We're here to help you understand your body with clarity and comfort. Recently, the FDA held a panel discussion on testosterone replacement therapy, something that's been shrouded in confusion, controversy, and frankly, unnecessary fear for far too long. I watched the entire hearing so you don't have to, and today I want to walk you through what was said, what it means for you, and why this conversation matters so deeply. Because here's the truth, testosterone isn't just about muscle or masculinity. It's about your heart, your bones, your mind, your ability to show up for the people you love and live the life you deserve. Understanding the real problem with testosterone care. Let me start by addressing something that came up right at the beginning of this FDA panel, and it honestly highlights exactly why they needed to have this conversation in the first place. Dr. Marty Makary, the U.S. Commissioner of the Food and Drug Administration, opened the panel by essentially downplaying testosterone therapy. He talked about how there are fewer research studies on testosterone compared to other hormone therapies, and that we don't fully understand all of its benefits yet. Now, I want to be fair. The panel did include some truly exceptional experts, urologists who've dedicated their careers to this work, who've treated thousands of men, who've conducted groundbreaking research. These are people I respect deeply, many of whom I've had the privilege of learning from. But here's where I need to pause and acknowledge something important. Some of the participants had disclosed financial ties to companies that manufacture testosterone. One was a consultant for a telehealth platform. Another was the CEO of a pharmaceutical company that makes oral testosterone. That gave me pause, because when someone has a financial stake in how many people get prescribed a medication, it's worth noting. At the same time, I want to be clear. The majority of the discussion was grounded in science, compassion, and genuine concern for patient care. Even the CEO, who I've met and who seems like a thoughtful person, contributed valuable insights for the most part. But let's get to the heart of it. Why does this matter? Why is testosterone replacement therapy so difficult to access, and why do so many doctors say no? Because low testosterone is a real problem, one that affects far more than your sex life. Think about it this way. Testosterone receptors are scattered throughout your entire body. They're in your brain, your muscles, your bones, your heart. When your testosterone levels drop, it doesn't just affect one thing. It affects everything. Studies estimate that about 20% of men are dealing with low testosterone right now. That's 1 in 5. And yet, only a tiny fraction, somewhere between 5 and 20%, are actually receiving treatment. Why the gap? It comes down to 3 things: misconceptions among healthcare providers, barriers to access, and a fundamental lack of awareness, both among doctors and patients. What low testosterone actually does to your body, and why it matters. Dr. Mohit Khera, one of the urologists on the panel, described this beautifully. He explained that testosterone isn't a lifestyle drug. It's not a vanity treatment. It's not just about looking good at the gym or performing in the bedroom. Testosterone plays a vital role across multiple organ systems in your body, and when you don't have enough of it, the consequences are serious. Let me share some of the numbers that came up during the panel, because they're eye-opening. Men with low testosterone are 17% more likely to develop cardiovascular disease. That's your heart we're talking about. They're 50% more likely to suffer a bone fracture. And here's the part that really struck me. When elderly men with low testosterone break a hip, their risk of dying within 1 year is 31%. That's 10% higher than it is for women. Hip fractures in men with low testosterone are life-threatening. Men with low testosterone are over 500% more likely to have diabetes. They're 69% more likely to struggle with obesity. They're 86% more likely to suffer from depression, and they're 6 times more likely to face infertility. And the one that concerns me most? Men with low testosterone are twice as likely to die from any cause compared to men with normal levels. Let that sink in for a moment. This isn't about vanity. This is about survival. This is about quality of life. This is about being able to show up for your family, do your job, move through the world with energy and purpose. Dr. Kara described it as a decrease in overall life productivity, and I think that captures it perfectly. My patients with low testosterone don't feel like themselves. They're not working at their best. They're not connecting with their partners the way they want to. They've gained weight they can't seem to lose. They're tired all the time. It's not laziness. It's not weakness. It's biology. Now, here's something else that often gets misunderstood. The idea that testosterone levels naturally decline with age. That's not entirely accurate. Yes, testosterone levels do drop slightly as we get older, but the real culprits are things like weight gain, diabetes, and chronic health conditions. Aging itself has minimal impact. It's the health issues that come with aging that drive the decline. So when we talk about age-related low testosterone, we're really talking about condition-related low testosterone, and many of those conditions are treatable. The panel also discussed one of the most important studies ever conducted on testosterone, the Traverse trial, published in 2023. This was the largest randomized placebo-controlled trial on testosterone ever done. Over 5,200 men received either testosterone gel or a placebo, and they were followed for nearly 3 years. These weren't young, healthy guys. These were men over 45 with existing heart disease or risk factors like high blood pressure, diabetes, or being overweight. And here's what they found. Testosterone didn't increase the risk of heart attacks. It didn't increase the risk of prostate cancer. It didn't worsen urinary symptoms. These are the exact fears that have kept doctors from prescribing testosterone for years. Fears that were based on a handful of flawed studies that got way too much attention. Because here's the thing. When something sounds scary, people listen. If I tell you this medication is dangerous, you're going to pay attention, even if the study behind that claim was poorly designed or statistically questionable. But if I tell you this medication is safe and helpful, it doesn't grab headlines the same way. And so for years, men have been denied treatment because their doctors believed testosterone would harm them, when in reality, it could have helped them live longer, healthier, more fulfilling lives. The barriers to getting the care you need, and what we can do about it. So if testosterone is so important, and if the research shows it's safe when used properly, why is it so hard to get? The answer is regulation. Testosterone is classified as a Schedule III controlled substance, the same category as narcotics. And that classification dates back to the Anabolic Steroid Control Act of 1990, which was passed in response to doping scandals in bodybuilding and athletics. Dr. Helen Burney, another urologist on the panel, put it perfectly. Testosterone is still regulated as if it were a dangerous performance-enhancing drug from the 1980s. And because of this outdated classification, many doctors are afraid to prescribe it, or even to screen for it. One of the panelists even pointed out that testosterone is regulated more tightly than cannabis in half the country, despite having a lower abuse potential than caffeine when used at therapeutic doses. Now, I want to be clear about something. There is a real risk of abuse when people take high doses of anabolic steroids. About 1 in 3 people who use supraphysiologic doses, meaning doses far higher than what your body would naturally produce, develop a dependence syndrome. They experience withdrawal when they stop. They take higher and higher doses. They continue using even when it's causing serious health problems. But that's not what we're talking about when we talk about testosterone replacement therapy. We're talking about bringing your levels back to normal, not pushing them into dangerous territory. The problem is, when doctors are afraid to prescribe testosterone, men go elsewhere. They buy it online. They get it from unregulated sources. They don't know if what they're taking is pure, or if it's been mixed with other substances, and they don't get the counseling they need about risks and side effects. Dr. Larry Lipsholtz, another urologist on the panel, talked about this issue, particularly the rise of online testosterone prescriptions. He mentioned a study showing that men are often able to get testosterone online even when their levels are completely normal and they're not being counseled about the risks. And that's dangerous. especially for young men. Because testosterone replacement therapy isn't without risk. When I start someone on testosterone, I tell them, this is likely a lifetime commitment. If you stop, your body won't immediately start making its own testosterone again, because it's been getting signals that it already has enough. And for young men, there's another critical issue: infertility. Even low doses of testosterone can shut down sperm production, sometimes permanently. That's why it's so important to have these conversations with a knowledgeable provider who understands your goals, your health history, and what you're hoping to achieve. The panel also discussed something I found fascinating: the question of whether we should be screening for low testosterone. My take? I think it's helpful to get a baseline level when you're feeling good, in your 20s, 30s, or 40s. That way, if you start having symptoms later, you have something to compare it to. But here's the thing: testosterone levels vary throughout the day, by the season, even by how much sleep you got. So we shouldn't be chasing some magic number. We should be asking, are you having symptoms? And if we try testosterone, does it actually improve those symptoms? Dr. Kara made an interesting point about young men specifically. When you look at men in their 20s with low testosterone, up to 30 or 40% of them have osteopenia, early signs of bone loss. That's significant. If we can catch that early and intervene, we might be able to prevent fractures and other complications down the line. What you deserve to know, and what I hope for you. Before I close, there's one more thing I want to address, something that came up in the panel that I didn't fully agree with. One of the panelists suggested that we need to fast-track approval for using testosterone alongside GLP-1 medications, the weight loss drugs like Ozempic and Wegovy, to prevent muscle loss. And I want to be careful here, because I don't think that's the right approach for everyone. Yes, when you lose weight, whether it's through diet, exercise, or medication, you will lose some muscle mass along with fat. That's normal. The key is to make sure you're eating enough protein and exercising regularly, especially resistance training. If you have symptoms of low testosterone and they're affecting your quality of life, then yes, testosterone therapy might be appropriate, regardless of whether you're on a GLP-1. But I don't think everyone on a weight loss medication automatically needs testosterone. That's not supported by the evidence we have right now. So as we wrap up, I want to leave you with a few thoughts from the panel that really stayed with me. One of the panelists said, "The demonization of testosterone is a tragedy. The dismissal of men suffering from testosterone deficiency is a scandal. And the failure to teach about testosterone deficiency in medical schools is a stain on our generation of medical educators." Another said, "This is not enhancement. This is restoration of health and dignity. And I believe that with everything in me. If you're struggling with fatigue, low mood, weight gain, difficulty concentrating, or changes in your sexual function, please talk to your doctor, ask to have your testosterone checked, and if they dismiss your concerns, find someone who will listen. You deserve to feel like yourself. You deserve to have energy for the people and things you love. And you deserve a healthcare provider who takes your concerns seriously. Thank you for being here. Thank you for listening. And as always, remember to take care of yourself, because you are absolutely worth it.